Welcome to the 2018 Lives in Medicine Conference. We started off the conference with Dr. Król, the president of the Polish-American Medical Society, and she discussed the differences between going to medical school in Poland versus the U.S.
We had Dr. Długopolska present about her path to medicine, and I think she really emphasized what it's like to be a female in medicine.
The presentations by Dr. Król and Długopolski and their perspectives on how getting into medical school has changed, and whether it's applying to Polish medical schools or staying in the U.S.
The presentation I had about finance, I think, was an eye-opener for many students who didn't realize how much debt can accumulate. I think it was also great that I showed the different scholarships that are available to students, especially students of Polish-American descent.
It's really fun for me to be a mentor to them and guide them through the process that I went through, because I know what it's like to be in their shoes. So overall, it's been really fun, really interactive, lighthearted, very helpful, I think.
The panel highlighted the different paths you can take.
I particularly like the panel to hear from other students about how they got to their specific professions and to see how that compares to where I am right now. The conference is great so far. I think it's a great opportunity for students interested in healthcare to see the different aspects of medicine and how we can get involved in it and eventually work in it. There isn't just one MD route, there's many other parts of medicine that need positions, such as NP, PA, pharmacist, dentistry.
I will be taking a gap year after I graduate, so I think it'll be a nice way for me to bring in what I learned today into figuring out my options.
I'm a medical student, and just even sitting on the panel in the last hour, I've learned so much about being a PA, being an MP, being a DO, some things that maybe I hadn't really come across that much so far in my training, and already feel more educated. So that's kind of a neat thing that I didn't realize I would learn today.
After the mentorship lunch, we had a series of breakout sessions that included a resource fair featuring universities throughout the United States and also job and volunteer opportunities within the Chicagoland area. We had a suture lab in which Dr. Piotr Pachul, a transplant surgeon, alongside Dr. Michalina Kupsik, a fifth-year general surgical resident, with Matt Graca, instructed students on how to suture.
We had students get the chance to take vitals, which again is another very basic skill that you don't always get the chance to do if you're not working in a clinical setting. We had students learn about the difference between an NP and an PA.
We also had an osteopathic manipulative medicine lab in which we had an osteopathic student explain the differences between an MD versus a DO and also how to do osteopathic manipulations.
So this conference has been such a pleasure. It is so empowering.
It's been nice to connect with other Polish people. I've never really had that opportunity much in the past.
He got eyelid transplant, so his life was substantially improved after the procedure.
Dr. Witkowski's research is pushing the boundaries. He's going to change lives for those with type 1 diabetes, and that's only one aspect of his research. What he's doing is it's not only great for the Polish-American community, but it's literally going to be changing the world.
Look for opportunities, ask people around for help, and then wait for the win. So wait for the opportunity. The opportunity will come.